COVID booster shots are now available to eligible Americans, and these healthcare systems are working hard to make these shots readily accessible to people all across Connecticut. Now, when you are eligible for your booster shot, that's going to depend on what vaccine you got the first time around. The CDC recommends that people who got Moderna or Pfizer get their booster shots at least 6 months after their second dose. Eligible Americans for those vaccines include people 65 and older, and people 18 and older are also eligible if they live in long-term care settings, have underlying health conditions, or work or live in high-risk settings. As for people who got that single-dose J&J shot, a booster is recommended for those 18 and up who were vaccinated 2 or more months ago.
The things that these vaccines are really good at is preventing severe disease, hospitalization, and death. And that is reiterated once you get a booster.
When it comes to demand for boosters, Dr. Syed Hussain says it is down from the initial vaccine rollout.
And there might also be some fatigue related to this, but it's important that as healthcare providers and organizations that we do our part in terms of educating folks. We can take lessons from Israel and other countries that have seen a spike in cases, even though they got a large chunk of the population vaccinated initially.
And just a reminder, the CDC and FDA have approved the mixing and matching of brands for those booster shots.
The mixing and matching portion is new to us, but it's not new in other parts of the world. For instance, we knew earlier this year AstraZeneca had issues, especially in women, when it came to rare side effect, clotting. And in the European Union, there were some countries, UK, Germany, and others, that actually started mixing and matching. So there's data from those countries that indicates immunity to COVID-19 is really robust, even with the mixing and matching.
Now let's talk young kids and vaccines. Dr. Hussain says the FDA is expected to weigh in on the decision to authorize Pfizer's vaccine for kids ages 5 to 11 this week. And then the CDC could give the green light next week.
It's a third of the adult dose, and it still confers a very high degree of immunity per studies, and also minimal side effects.
Angelo Bavaro, Fox 61 News.